Hey, welcome to day one of treatment of mental disorders. And so, before we get started on specific therapeutic techniques, let's talk about careers. So, let's say you want to get some help or you want to get somebody to get some help. You need to know what kind of help to get. And it's not always clear, but let's say you want to see a psychiatrist. So let's talk about this. Let's talk about you. How do you become a psychiatrist? First of all, you get your bachelor's degree. That takes about 4 years. And then you do not get your master's degree. You go to medical school. That's what you do. And medical school takes a long time. It takes about 8 years. Now, I get a little confused on the details. You'll need to talk to someone who knows more about that than I do. But if you want to become a psychiatrist, you go to medical school. So you get your 4 year bachelor's, then you go to medical school and you get your MD. That means you're a medical doctor. So you also get paid more than other kinds because you're more in debt. You invest more into your education. You get paid more to be a psychiatrist than, say, a counselor or a psychologist. So, how do psychiatrists treat mental disorders? Well, they use medicine. Also, and this is a word we'll use later more, they use what's called a biomedical therapy. Bio, think biology, medical. So now I'm going to say something that's a little ugly, but they use a lot of pills. So let's say you're depressed. Oh, well, let's give you some antidepressants like Prozac or Zoloft or something like that. If you're hearing voices, they'll give you an antipsychotic. If you have anxiety, they'll give you an anti anxiety medication like Xanax or something else. Okay. Sometimes they're called shrinks, but if you need pills and you need biomedical therapy, there are other kinds of biomedical therapy, but medicine is the most common one. Okay. Then you might go to a psychiatrist. Okay. Now, I'll be honest with you, if you were to go to your normal medical doctor and you need an antidepressant, they'll probably prescribe you one. But if you want to see a specialist, go to a psychiatrist. Now, what if you what if you have a disorder where there's no pill for it? Let's say you have a personality disorder, like you're a narcissist, or um, you have obsessive compulsive disorder. There's no pill for that. So, what you would do is you would go see a psychologist or a clinical psychologist. And you might get medication, but you wouldn't get it from a clinical psychologist. You'd have to get it from your regular doctor and then on the side go see your clinical psychologist for your psychotherapy. So, how do you become a clinical psychologist? Well, you go to college, you get your 4 year degree in pretty much whatever you want. Then you get your master's degree. That takes a few years. And then you get your PhD. And in that time, you have an internship, that practicum or residency, something like that. Sorry, I don't know the exact terminology, but you'll do that for a couple of years. You'll work with somebody else and you'll learn how to be a psychologist. So, psychologists treat things where there is no pill for, like personality disorders, anxiety disorders. Yes, you could take Xanax, but it's not going to cure it. Okay. If you want to cure it, then you need to see a psychologist. Addictions, there's really no pill for that. So, it just depends. And they talk to you and they do things that we'll talk about later. And you've seen some in the show Obsessed. Hopefully, you recognize this woman in this picture from the TV show Obsessed. Okay. Counselors, they they only need a master's degree. Now, that doesn't mean that they're not good at what they do. Now, I'm going to say something that's a bit controversial, but let me try to distinguish a counselor from a psychologist. Counselors don't treat mental illness. Now, don't get me wrong, they deal with it. But if you were to go to a counselor and you were to tell a counselor, I'm hearing voices, I'm suicidal, or something like that, then they would send you to a psychologist or a psychiatrist. Okay. Now, why would you go to a counselor? Well, counselors are really good at helping you to communicate. Let's say you want a marriage counselor to help you and your husband or you and your wife communicate. Or let's say you want somebody to give you some life strategies, like a life coach or something. Grief counseling. Let's say somebody important to you just died and you want to talk it out with a counselor for a couple hours. Okay. Those are not mental disorders. So you don't go to a psychologist for that stuff. And you certainly don't go to a psychiatrist for that stuff. Let's say your parents just divorced and you're having trouble dealing with that. You're having trouble talking to your parents like a human being. Go to a counselor. You might even go to a family counselor. Now, if you want to become a counselor, get your bachelor's degree. That takes about 4 years. Then get your master's degree. And then you do what's called a practicum. You get your LPC, that's licensed practitioner counselor. And if that's something that you want to do, look into it. Now, this is not a therapist. This is just, we're talking about careers, so I wanted to right here. An industrial organizational psychologist, what they do is they go to college and they get a master's degree in industrial organizational psychology. Then they go work for these big corporations and like think The Office, the show The Office. And what do? Well, they use psychology to help managers treat their employees in a way, not necessarily better, but in a way that makes employees productive. So let me ask you this. If you're going to be the boss, would you want to be a really mean boss? Or would you want to be a really easygoing boss that serves alcohol on Friday afternoons? I don't have an answer for you, but there are benefits and drawbacks to both. And employee productivity is something that they talk about. They talk about management styles. They also talk about team building. We all have this stereotype of the trust fall, like you fall backwards and your coworkers catch you. That's kind of the thing that they might do. And I believe they do a lot of surveys. They ask you, they'll put out surveys for employees to ask, and they'll ask you things like trying to measure your self efficacy. Like, do you as an employee feel like you could make a difference in the company? Do you feel like you have an open environment where if you had an idea how to improve something, that you could say something to your supervisor? So um, they're measuring management styles when they do things like that. So that's another career option for you if that sounds like something that you're interested in. The picture on the right here is a college textbook. Okay. Forensic psychology. I know a lot of y'all have been watching strange, Criminal Minds and Dexter and things like that, and you want to go catch the bad guys. I wish there were more jobs out there, but I have heard that there are very few jobs out there where you get to profile serial killers and do things like that. But if you want to major in forensic psychology, or you at least want to take an interest in it, take a class or two on it, then go to FBI.gov, see what kind of jobs they have, and go work for the FBI. I mean, there's nothing stopping you. You can use all this stuff and still work for the FBI, or you could become a detective. If that's something that you want to do, go for it. So look into that. But what forensic psychologists do is they spend a lot of time going to court. Remember Andrea Yates, who drowned her 5 kids? Well, a forensic psychologist testified at her trial and said Andrea Yates was not aware of what she was doing. She was psychotic. She had lost total control with reality, so she should not go to jail. Instead, she should go to a mental hospital where we can monitor her medications and we can rehabilitate her. So Andrea Yates, after all these years, is not in a jail. I mean, pretty much she is, but she is in a locked up mental facility in Texas. Okay. So forensic psychologists, they testify a lot, they interview defendants. So they spend a lot of time talking to people who had just done some really horrible things. Okay? So check out this question. All right, Mr. Denton was hired by the TLC company to help them retain their employees without lowering the firm's profits. After TLC removed cubicles and permitted employees to decorate their workroom, as recommended by Mr. Denton, the absentee rate declined and no employees left for jobs elsewhere. So the answer is B. He's an IO psychologist, an industrial organizational psychologist. Okay. Matt enters therapy to talk about some issues that have been causing him distress. The therapist has earned a PhD and uses a variety of techniques to alleviate, that means to lessen, some of Matt's distressing symptoms. So, is he seeing a psychiatrist? No, he's seeing a psychologist, a clinical psychologist. If you're going to go to a psychiatrist, they'd probably give him medicine. Leadership, job satisfaction, and employee motivation are all studied in which of the following psychological disciplines? The answer is B. Okay. Which of the following would an industrial organizational psychologist be least likely to study? Now, hit the space bar or hit pause. This is a hard question. I really struggled with this question. The answer is B. Now, if you got it right, congratulations, but I got a little confused with this one because ultimately, you want to save money by not having to retrain new employees all the time, okay? But the reality is that corporate profitability covers, that's studied by accountants. But all this other stuff, that's industrial organizational psychology, okay? In contrast to a clinical psychologist, a psychiatrist is more likely to do what? Okay? And sorry if I didn't teach this good enough, but the answer is B, biomedical, biology, medical. They'll give you pills or give you shock therapy or something like that. Soma means body, so somatic means of the body. Okay? An industrial organizational psychologist would be most likely to study the what? Hit pause. The answer is C. Okay, management training. Remember earlier when I said you want to be a jerk manager or do you want to be easygoing, somewhere in between? These guys study that. All right, moving right along. So let's talk about therapy. Okay, and we're not going to get to them all in this video, but we'll get to them eventually. So let's start with psychoanalytic. Now, let's start with the idea. Based on the ideas of Sigmund Freud, what causes mental disorders? According to the psychoanalyst or the psychodynamic perspective, it's something in the unconscious mind or something repressed. Remember, we'll press it down. So if something traumatic happened to you and you pressed it down into the unconscious, then according to these guys, those repressed thoughts or repressed feelings are coming back up in the form of a mental disorder. I'm not saying I agree with them. I'm just saying that this is what they thought maybe 100 years ago. It's always something in the unconscious. Now, this is a lot of stuff right here. And when in class, I have students write all of this down. What do to get into the unconscious mind and bring it up to the conscious mind? They do these techniques. They analyze your dreams. Okay. There's something called transference. Let me explain what that is. It's not really a method, but it's a goal. If you're sitting there talking to a patient for hours and hours and hours, like psychoanalysts did, and then the patient is to have some sort of emotional outburst toward the therapist or an emotional connection. Imagine you're talking to them and then they get frustrated. You left me, daddy. You're like, whoa, I'm your therapist. I'm not your daddy. What they do is they take strong feelings that they have towards somebody else and project them onto the therapist. some patients will actually come on to their therapist. Now, of course, this is old school and we don't promote this anymore, but that's called transference. Hypnosis, dig deep into the unconscious mind and bring it up. Free association, have them lie down on the couch, because that's psychoanalysis. You have them lay on the couch for hours and just start talking about whatever. And then they talk for hours, and then the doctor sits there with their notepad and interprets what they say as a hint into the unconscious mind. So you ran into a woman on the bus. Are you sure that that wasn't your mother? They always bring your mama into it somehow. That's how psychoanalysts are. Free association, you talk freely about whatever comes to mind, and then the doctor looks for clues into the unconscious mind. That is free association. And all 5 of these are about getting into the unconscious and bringing it out into the conscious mind. That's a lot, but that's it. That's psychoanalysis, founded by Sigmund Freud about 100 years ago. So this is a joke. Psychoanalysts don't talk a lot. Okay, the patient lies on the couch and they just talk for hours and hours and hours. And they don't say much. That's a joke. Sigmund Freud, put him on the couch and turned him the other way because Sigmund Freud said that he did not want us to look at their face after hours and hours. That's why he did the couch. Okay. So, psychoanalysis. Unconscious thoughts and emotions are brought into awareness to be dealt with. Psychological problems are the result of unconscious processes. Bringing unpleasant, unconscious thoughts into the consciousness produces catharsis, that emotional release of getting it out into the open. Okay? So basically, this is exactly what I just said. If you want to hit pause and take a look at it, it's the same thing I just said. Okay? Freud said that if you dream about doing something, then that means you unconsciously want to do that activity. If you dream of buying a bicycle, then Freud would have said that you want to buy a bicycle. He says that dreams represent a form of wish fulfillment. Transference. Hit pause and read that if you want. So, this is the summary. What causes mental disorders? Something in the unconscious. How do you treat it? Probe the unconscious mind and bringing it out into the conscious mind. And we call that psychoanalysis. That's the treatment. So let's look at some multiple choice. The goal of psychoanalytical therapy is what? Okay. So look for something involving the unconscious mind. The answer is D. During a therapy session, a client acts very angry toward the therapist, just as she acts toward her mother. So what's this called? Hit pause. When you have some kind of emotional outburst toward the therapist, that's called transference. According to psychoanalytic theory, the bases or the cause for the development of mental disorders are what? Okay, so remember the key word. Look for something along the lines of the unconscious mind. A psychoanalyst who believes in the theories of Freud would see mental disorders as caused by, okay, so look for something in the unconscious, but it doesn't say unconscious. It says repressed. So remember, when you repress something, you press it down into the unconscious mind. Sigmund Freud said that we take our boys, we're unconsciously attracted to their mothers, and they repress those feelings. And he said, and I'm not agreeing with him, he said that that causes a lot of our anxieties as adults. All right, moving right along to a whole new perspective. So in the 40s and the 50s, and really in the 20s and the 30s, the behaviorists are going to come along. The behaviorists are led by B.F. Skinner, John Watson. You might remember Pavlov, who trained the dog to drool to a bell, Albert Bandura, and what a lot of people did is they took these psychological concepts and they turned them into a really interesting form of therapy. Now, unlike psychoanalysis, behavioral therapy is still a big thing. It is still around just fine for certain mental disorders. So, behaviorists believe that mental problems are caused by conditioning. For example, classical conditioning, operant conditioning, and observational learning. Okay? So, like for example, classical conditioning. Let's say you were attacked by a dog. All right. So now you are classically conditioned to fear dogs. That's how classical conditioning could cause an anxiety. Operant conditioning. Why do you gamble? Well, maybe you're rewarded for gambling because it's fun and you win money sometimes. And the dopamine that you get from gambling. Why are you addicted to drugs? Well, you started doing drugs because of the dopamine. But also think about this. Think about your friends. What if all of your friends are alcoholics and you don't want to stop being an alcoholic because your friends reward you for drinking? That's how operant conditioning can cause a problem. Even depression. Imagine if you're depressed and then you're in a good mood one day and your friends say, "Oh my God, are you like totally Miss Cheerleader now? Because you're all happy. You're much more fun when you're depressed." You see that your friends punished you for being depressed. That's operant conditioning. And finally, observational learning. So we observe our parents have a mental disorder, we observe our friends have a mental disorder, and we just pick up on it. So if our mom is depressed and our dad is depressed, we observe that and we mimic or copy that behavior. I'm not saying that that's always the case, but it's a possibility. If your mom has an eating disorder, maybe you'll watch that and you will learn to throw up all your food after you eat. That is observational learning. So, how do behaviorists treat mental disorders? They use classical conditioning, they use operant conditioning to change the maladaptive behavior, change the behavior. They don't dig into your unconscious mind. They don't interpret your dreams, they change the behavior. So let's get it more specific. Okay, I have students write all of this down. Systematic desensitization. Make sure you watch that episode of Obsessed of somebody with obsessive compulsive disorder. How do you treat something like that? You expose them gradually and systematically to what bugs them, what gives them anxiety. If they have a phobia, expose them to what gives them that phobia. Flooding. Well, imagine I have claustrophobia and I don't like closed in spaces. So my therapist grabs me, throws me into the closet, comes into the closet with me, and then tells me to breathe and relax until my anxiety goes down. So overwhelm my senses with what bugs me. So it's like systematic desensitization, but it's just a little bit more extreme and a little bit faster. I was watching The Biggest Loser, and this girl was afraid of getting into the pool. So her trainer got in the pool with her, gradually walked her around the shallow end, told her to breathe, held her hand, and said, "See, everything's fine." So she got into the pool with this woman who was afraid of the swimming pool. That would be flooding. And then aversion therapy. You're going to need to see videos on this. Um, Especially American Horror Story season 2, where the star they were trying to cure her of her lesbianism by giving her a substance that made her sick and vomit while she was looking at attractive women. That's aversion therapy. Aversion therapy is when you want to stop a behavior and then you associate that behavior with something unpleasant, like, let's say, nausea. Okay, you might remember. You might remember if you're an alcoholic and you take a pill, and then the pill mixes with alcohol, makes you sick, and then you throw up. Then it makes you classically conditioned not to want to drink alcohol anymore. All three of these use classical conditioning. It's because you're creating an association in your mind. Okay, so for systematic desensitization, a good short film would be on, and I'll link to it on the YouTube page or something, but a guy who is afraid of pit bulls and his therapist gradually exposes him to a pit bull puppy. Okay, but obsessed is better. Obsessed is better for that. All right, Joseph Wolpe, he's the one who apparently invented systematic desensitization. He says that you teach the client relaxation techniques, breathing, stuff like that, and then create a hierarchy. Ask the patient, give me on a scale of 1 to 10, how much anxiety do you get from looking at pictures of spiders? On a scale of 1 to 10, how much anxiety do you get from this toy spider? You know, on a scale of 1 to 10, how much anxiety do you get from knowing that there is a spider in the corner over on the other side of the room? And then what Joseph Wolpe would do is expose you starting low and gradually expose you to all of the stimuli that you're afraid of to get rid of your phobia or to get rid of your obsessive compulsive behaviors. Mary Cover Jones was the founder of counter conditioning. She was a student of John Watson. Remember little Albert? She was John Watson's student. And she took a little boy named Peter who was afraid of rabbits. And then she would expose the boy to something that the boy liked, like cookies. And then pair that with the rabbit, and then eventually the boy would not be afraid of the rabbits. That's called counter conditioning. So her name is Mary Cover Jones. Okay. All right. Operant conditioning. How would you use operant conditioning in therapy? Well, there's one way called token economy. And token economy uses operant conditioning. If you are in a mental hospital, some mental hospitals take a clue from elementary schools. Remember elementary school when you would get these tokens or these privileges or these stars that you would trade for other privileges because you acted good? Basically, token economy is when you do that in a mental hospital. You got to see a little bit of that in the Netflix film To the Bone. And if you haven't seen that, watch it. It's on Netflix. It's called To the Bone. And there's Keanu Reeves, and he plays a doctor who is treating women with eating disorders. And so if you participate in therapy, you get points, and you can use those points to do things like eat, well, probably not eat, but go to the movies, things like that. All right, so try this question. Thomas gained a lot of weight because he was eating too many sweets. A psychologist suggested to Thomas that he pair the pleasant taste of sweets with the taste of something he finds unpleasant. So Thomas put broccoli, which he hates, in his ice cream, in his cake, and in his pie. Now he feels nauseated at the sight of dessert and avoids eating it. All right, so what are we doing with Thomas here? We're doing aversion therapy. Aversion therapy is good when you want to stop a behavior. Now, check out gay conversion clinics. Those are illegal, but what they try to use aversion therapy to get people from stop being homosexual. Systematic desensitization is most likely to be used in the treatment of which of the following? Okay, think back to the show Obsessed. It could be used for obsessive compulsive disorder, but can also be used for phobias. Expose and desensitize people to the phobias. We've got plenty of films on that topic. A teacher taught her students to take turns by giving them stars to trade for snacks at the end of the day. This is called token economy. Token stars. A therapist using systematic desensitization to help a client overcome a fear of big dogs would probably begin treatment by asking the client to do what? Okay, I'll be honest with you. I missed this question, but because of all the videos I saw. But if you go back to what Joseph Wolpe did, he started with relaxation techniques. Breathe, tell yourself everything's going to be okay. I honestly missed this question when I first saw it. But think back to Joseph Wolpe. Okay. Relaxation techniques. Jim decides to seek treatment for his alcoholism that involves taking a medication that causes nausea when paired with alcohol. Okay, so that's aversion therapy. But what umbrella does aversion therapy fall under? Is it psychodynamic? Is it behavioral? The answer is it's behavioral therapy because drinking alcohol is a behavior. Which of the following treatments would be most effective for someone who experiences a rapid heartbeat, lightheadedness, and nausea when speaking in public? So this to me sounds like a phobia. So how do you get rid of a phobia? Systematic desensitization. And you could do this with virtual reality. If a man who is a heavy smoker is given an electric shock every time he takes a puff on a cigarette, which of the following behavior modification techniques is being used? The answer is, now earlier I said aversion therapy. This says aversive conditioning. So that's going to have to be close enough. Staff members at a mental health hospital do not respond to patients who use threats, but praise patients who are courteous. So they're using operant conditioning. So this is behavioral therapy. If they were trying to get into your unconscious mind, then it would be E, but it's not. So, in summary, what causes mental disorders? We're conditioned to be sick through classical conditioning, operant conditioning, and observational learning. How do you treat it? You change the behavior through conditioning. Aversion therapy, aversive conditioning, token economy, and also modeling for our friends and for our kids. If you don't want your kids having an eating disorder, then don't throw up in front of them. Okay? Now, one more perspective on this video, humanistic perspective. Now, check out what's going on in the picture. Someone is throwing out the couch. Now, what does the couch symbolize? Psychoanalysis. Remember, Freud would have his patients lie down on a couch. Well, the humanists are going to come along in the late 50s and in the 60s and throw out the couch symbolically. And I want you to think of hippies, but even better, think beatniks. I hope you know what a beatnik is. Your 11th grade teacher probably would tell you. But beatniks are like people in the 50s who always wore berets and they read slam poetry and listened to jazz. They're kind of like 1950s hipsters. They thought they were so cool. But they came along and they're like, hey man, we've got free will, man. We're not id driven and we're not pigeons in a cage, man. We're free human beings, man. That's how humanists are. I make fun of them, but they did a lot of good for psychology. So, this is a major perspective of psychology. It focuses on maximizing human potential, free will. Okay, they say that we all have free will, unlike psychoanalysts. Important people include Carl Rogers and Abraham Maslow. Think hippies. Now, again, I'm exaggerating for effect, but humanism and hippies both begin with H. So, who is Carl Rogers? This guy came along in the 60s and he changed therapy forever. He was the founder of what we call client-centered therapy, okay, which means instead of the therapist knowing everything, the client or the patient knows what they need to know and they will direct the direction of therapy. So if you're a client, then you might be asked, what are your goals? What do you want to achieve in therapy? Okay, that's good. Active listening. So the therapist isn't just going to sit there and take notes for hours. The therapist is going to listen to what you have to say, repeat what you have to say, get clarification. And so they'll say something like, so what I hear you saying is blah, 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 blah. And that allows you, as the patient, to say, well, yeah, that's kind of what I said, but what I really meant to say was blah, 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 blah. Carl Rogers believed in unconditional positive regard, meaning don't be judgmental to your patients. Okay? So if your patient comes to you and says, I'm sexually attracted to women's feet, you don't want to be judgmental. Okay? You want to be open minded and not be judgmental. That doesn't do your patient any good. And be empathetic. Don't be such a cold fish. Say things like, wow, you really must be going through a really hard time. This must be so difficult for you. That's empathy. Okay. All right. This really isn't therapeutic, but Carl Rogers came up with this. This could be in the personality chapter, but I want you to take a moment and imagine your ideal self, who you want to be. Okay. And then look in the mirror and see your real self. If your real self doesn't match your ideal self, that's not a good thing. If they're close together, Carl Rogers called that neurosis. But if they're far apart, then he'd call that the shattered self. But if they were congruent, if they were kind of the same, Carl Rogers called that being a fully functioning individual. So basically, this is Carl Rogers' version of maximizing your potential. Okay, so what do you want to be with your life? How do you become a fully functioning individual? Okay, so remember, humanists believe we have free will, unlike psychoanalysts and behaviorists who believe that our destiny is almost determined, meaning we're controlled by our unconscious mind. Behaviorists believe we are controlled by our environment. Humanists believe we don't have these constraints. We could be whatever we want to be. We could be a fully functioning individual if we want to be. Okay. So I already talked about this. Hit pause and look at this stuff. Try this question. Sandy's father's behavior gives her the impression that he will love her only if she gets very good grades. Carl Rogers would probably say that Sandy. Okay, so unconditional positive regard would be like your mom loves you no matter what. Oh, you got an F. Oh, you're such a sweet little boy. But what Sandy is getting is conditional positive regard. I will love you only if you make good grades. I will love you only if you become a doctor or a lawyer. Okay, that would be conditional positive regard. Now, what is unconditional positive regard? Replace the word regard with love and you get unconditional love. And you don't want to love your clients, so take love and replace it with positive regard and you get something that's similar but it's more professional and therapeutic. That's unconditional positive regard. It's like unconditional love, but it's more therapeutic and professional. During therapy sessions, Tanisha's therapist often rephrases things that Tanisha has said or asks for clarification. What's her therapist doing? The answer is D, active listening. So instead of just sitting there quiet for months on end, the therapist will take what you say and reflect it back to you. Your therapist might say, so let me get some clarification here. What you're saying is blah, 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 blah. Then that allows you to clarify it and allows you to hear it from somebody else and allows you to correct that thinking. So let's talk about Abraham Maslow. Maslow comes along, he's also a humanist, and he comes along with this. Write this down, memorize most of it, kind of absorb it. So at the bottom, basically here is Maslow's hierarchy. Maslow said that you have to take care of the needs at the bottom first, then you take care of the higher level needs. So if you are in danger and you're hungry and you're homeless, then there's no way that you could focus on school. There's no way that you can focus on friendship if you are in danger and you're afraid that you're going to die. Same thing. Let's say you find out that you are going to get laid off and you are going to lose your job. Do you really think you could focus on any of this other stuff up here? Heck no. You're too worried about your job. Okay? So, and then when you get to the top, at the very top, you get self actualization. That is the making the most of your potential, maximizing your potential. Abraham Maslow called that self actualization. Think of it as be all that you can be. Okay? Be the best version of yourself. Okay? Now, let's talk about esteem need, love and belongingness needs. Love and belongingness is you want to fit in, you want to be a part of the group. Esteem needs, you fit in, but nobody respects you. Esteem means that you're competent, you get everyone's approval, and you get recognized for your achievements. And then the higher level needs would be basically your education. So think about this. Do these people have self-esteem issues? It's a ridiculous question because they're in danger. Their lives are in danger. They're not worried about higher level needs. Okay. So take a look. Now, I'll try to go through this really fast, but think about The Simpsons. Who is at the bottom of Maslow's hierarchy? Well, there's Gil and the crazy cat lady who are homeless, so they're at the bottom. Who is in danger? Who is having trouble meeting their safety needs? So I thought of people who have homes, but they live in shacks. Okay, or Nelson is neglected. Who has love and belonging needs? Who wants to fit in on The Simpsons? Lisa, Milhouse. And then in this episode, Stan is trying to fit in with the golf kids. And then Butters always has love and belongingness needs. He wants to fit in. Esteem needs. Who wants respect? Who wants to be recognized? Well, it's hard to believe that Bart and Homer are so high, but then again, it's just a fictional show. Self actualization? I would say no, but maybe one episode. Like there was this one episode where Grandpa beat Burns and won the love of his family, but it all goes back to normal in the next episode. Okay. Hit pause if you want to look at this regarding Twitter. That's a joke. Humanists are all about finding yourself. Okay, so humanists are really touchy-feely, but without them, we're just pigeons in a cage. Carl Rogers and Abraham Maslow put the human element back into psychology and therapy. Their philosophy is this: we are all humans striving to maximize our potential. A therapist's job is to remove obstacles to self-actualization. What is it going to take for you to maximize your potential? What is getting in your way? That's what a therapist's job does. Okay. So, individuals who exhibit a strong moral sense, accept themselves as they are, and are deeply democratic in nature, and are willing to act independently of social and cultural pressures would be described by Abraham Maslow as what? All right, so think of the top of the hierarchy. If you put C, that was Carl Rogers. but E, that's Abraham Maslow. This is a real nitpicky question. Most questions are not this nitpicky. According to Maslow's hierarchy of needs, the need to have respect for ourselves and to be valued by others is classified within the category of what? Ooh, wow. Okay, take your time, hit pause. And the answer is not C, but it's D. Okay? Belongingness needs would be just to fit in, but D would be to be respected. That's a higher level need. Client-centered therapists try to appreciate how the world appears from the client's point of view. This is an example of which of the following concepts? That's empathy. Feel what the client is feeling. Remember, there's feeling sorry for somebody and then feeling for somebody. That's empathy. Humanistic psychologists believe that the drive towards self-actualization is what? I didn't teach you this good enough, but the answer is D. It's innate. You're born with it. It's natural. Innate means that you are born with it. You don't learn it, you're born with it. Which of the following correctly list Abraham Maslow's hierarchy of needs from bottom to top? Okay, so this was on the AP exam, but I deleted one answer. The answer is D. Okay, you just got to kind of know it. Okay. An important difference between humanistic and psychoanalytic approaches is that humanistic psychologists believe in the importance of what? The answer is B. Psychoanalysts believe that you are constrained by your unconscious mind. Humanists don't believe that we have those constraints. That is it. Thank you very much.